السلام عليكم ورحمة الله وبركاته. اليوم بدنا نحكي عن موضوع من المواضيع المهمة في الروماتولوجي، ألا وهو بعنوان Systemic Vasculitis. The overview of these lectures, as you see, classifications of vasculitis, definitions, epidemiology, clinical features, investigations, therapy, and prognosis. Definition of vasculitis: it is a group of conditions which characterized by inflammatory cell infiltrate and necrosis of the blood vessel wall with impairment of blood flow and sometimes damage to vessel integrity. They presented with as multi-system disease, and the symptoms of this group of diseases depend on the size of and the site of blood vessel involved, and this group of diseases has remitting and relapsing course. As you see, there is two types of vasculitis: large vessel vasculitis like Takayasu syndrome and giant cell arteritis, medium artery vasculitis like Kawasaki disease and polyarteritis nodosa, medium and small artery vasculitis like Wegener granulomatosis, Shirk-Strauss disease, Behçet disease, and microscopic cholangitis. And there is a small vessel vasculitis like Henoch-Schönlein porphyra and leukocytoclastic vasculitis. Also, the second type of vasculitis is secondary vasculitis due to connective tissue disease like rheumatoid arthritis, SLE, or Sjogren's syndrome, infectious disease, drug-induced malignancy. هذه كلها could be or should be excluded in order to diagnose vasculitis. Some point about the epidemiology of this disease. The incidence, overall incidence, 43 cases per 100 person. For example, rheumatoid arthritis 12.5, Wegener 8.5, microscopic cholangitis 2.4, polyarteritis nodosa 2.4. Age can affect all the ages, but 60 years, it ranges from 16 to 82. الجندر male to female تقريبا nearly equal or 1.3 to 1 male to female. These are the history, as I mentioned before, these are multi-system diseases, affect many organs. Onset may be acute or grumbling. Systemic upset like fever, anorexia, weight loss. These are general symptoms. Skin manifestations: porphyric skin rash, vasculitic skin rash, which is not blanched by pressure. Digital infarction and gangrene could be a manifestations of this disease. Red eye, pain, photophobia, ENT, epistaxis, crusting, sinusitis, and hoarseness of the voice. Vasculitis history continued in the cardiovascular and respiratory system. They can come presented with chest pain, difficulty in breathing, hemoptysis, and asthma. GI symptoms like abdominal pain, bloody diarrhea, and neurological symptoms like weakness and numbness. Musculoskeletal history: arthralgia, pain, tenderness, and swelling, myalgia, pain, loss of muscle bulk and weakness. General clinical signs in vasculitis disease. أول حاجة general features: As I mentioned before, fever could be the first presentations of vasculitis, and muscle wasting, general weakness. If you look at they used to have inflammatory arthritis, often asymmetrical arthritis and oligoarthritis. Oligoarthritis, it means 3 joint or less, from 1 to 2, 3, up to 3 joint, and asymmetrical joint affection. These are the skin lesions and signs which we can found in patients with vasculitis: purpuric rash, nodules, digital infarction, ulcerations, or gangrene. All these are manifestations. Also, mouth ulcerations, mouth ulcers, orogenital ulcers, one of the manifestations, mouth ulcers, nasal ulcers, genital ulcers, red eye, and uveitis. Uveitis with hypopyon. This is hypopyon, هو pus collection in the anterior chapter of the eye. Hypopyon we can see in patients with Bahjat disease, which is a kind of vasculitis. Episcleritis, scleritis, and scleromalacia. This is the eye manifestations of patients with vasculitis. ENT, nasal collapse, as I mentioned, nasal collapse, sudden nose, we called it stridor, from laryngeal disease. Respiratory and cardiovascular signs, hemoptysis, they come with pulmonary nodules or pulmonary hemorrhage, which come with hemoptysis. Crackles, when you hear this chest, you will hear crackles. Wheezy chest, like patient with Shirk-Strauss disease, they used to have. One of the manifestations is bronchial asthma, especially in elderly patients more than 50. Any patient more than 50 presented with asthma, you have to check him for secondary causes like Shirk-Strauss disease. And pericarditis can cause pericardial effuge, pericarditis, inflammatory process in the pericardium, which manifested by chest pain. This chest pain is increasing by lying down and improving by leaning forward. يعني ما هو نايم الوجع بيزيد ولما يصحى ويطمن قدام الوجع بخف. Right? And neurological signs include peripheral neuropathy, glove and stocking, mononeuropathy, and mononeuritis multiplex. These are the neurological manifestations of patients with vasculitis. Neurological signs, neuropathy, like motor and sensory, peripheral impairment, like carpal tunnel syndrome, sensory neuropathy. Also, there is cervical spine involvement in subluxation of cervical vertebral, cervical myelopathy, local pressure on the nerve root. These are the nerve which can be affected in patients with vasculitis. Abdominal signs. Some vasculitis can come mainly with abdominal pain, like polyarthritis nodosa can cause pancreatitis. SLE can cause pancreatitis, which come with severe abdominal pain. Polyarthritis nodosa can cause hydrops gallbladders. Helicospora purpura can cause hydrops gallbladders. All these can cause abdominal pain, liver and gallbladder, intestinal obstruction, and peritonitis, local or generalized. These are the tenderness in these conditions. And this is the celiac angiography, and you will see the vasculitic lesions in the angiography. Some examples of primary vasculitis: Takayasu, arm, leg claudication, broy, and decrease or absent pulses. giant cell arthritis. عندك أيضا عندك هو البوليارثرايتس نودوزا, weight loss, diverticulitis, neuropathy, renal infarction, abdominal pain. Shirk-Strauss, they used to come with asthma, eosinophilic eosinophilia, neuropathy, pulmonary infiltrate, Wegener granulomatosis. Now they changed the name of the polyangiitis with eosinophilic granulomatosis, upper and lower airway disease, renal disease, neuropathy, Bahjat syndrome. We talk a lot about this disease, recurrent orogenital ulcerations, uveitis, thrombophlebitis. Helicosporidium purpura, they can come with skin manifestation, abdominal pain, and bloody diarrhea. These are some examples of primary vasculitis. Now, how I will investigate patient with investigations to consider in patient with suspected vasculitis. We have to do urine analysis, renal function test, urea, creatinine clearance, 24-hour urine collection for protein. We have to do liver function test, CRP, hematology. We will do full blood count and eosinophilic count and ESR. Immunology, we will do anti-neutrophil cytoplasmic antibodies, ANCA, rheumatoid factors, and ANA. Investigation 2, we have to do microbiology, like blood and sputum culture, medicinal urine, stool culture, virology, hepatitis B and C, radiology, chest X-ray, sinus X-ray, CT scan, the chest, MRI, angiography, echocardiogram to exclude cardiac myxoma or subacute bacterial endocarditis. And finally, we have to do biopsy, often needed to confirm the diagnosis. We can do skin biopsy, nose, lung, kidney, rectum, nerve, and muscles. Right. A little bit on ANCA testing. It is IgG ANCA detected using indirect immunofluorescent or ELISA. Ethanol fixed neutrophils express intracellular granules on cell surface. ANCA against proteinase 3, weak cationic, has a cytoplasmic or C ANCA pattern. ANCA as against myeloperoxidase, strongly cationic, has a perinuclear or P ANCA pattern. Other ANCA against elastase, cathepsin, G, and etc. And the neutrophil cytoplasmic antibodies test has been found to be positive in vasculitis, inflammatory bowel disease, autoimmune liver disease, and SLE, in infections and malignancies. ANCA in vasculitis. See ANCA positive in 90% of patients with Wegener disease, may reflect disease activity, may predict relapse. P ANCA positive in 15% with Wegener, 60% in microscopic cholangitis, 50% in Shirk-Strauss disease, and 10% in polyarteritis nodosa. What are the serious complications resulting from vasculitic disease? And these are, if you diagnose and it is preventable, gangrene or infarction of the skin or adenitis, nasal collapse and subaortic stenosis, pulmonary hemorrhage, coronary arteritis, neuropathy, mononeuropathy, or multifocal neuropathy, renal failure, acute or chronic. Differential diagnosis may be wide, infectious disease like chronic or atypical endocarditis, connective tissue disease like SLE, malignancy, and there is another things which called pseudovasculitis, اللي هو cholesterol immobilization syndrome and atrial myxoma, sarcoidosis, and HIV. There is some drugs can cause vasculitis like propyltyrosine and allopurinol, hydralazine, procainamide. Therapy. Therapy to suppress disease activity and then to maintain remission. Remission including induction steroids, that cyclophosphamide, continuous oral or pulse therapy, maintenance therapy, azathioprine, hydroxate, and septrin. Adjuvant therapy, intravenous immunoglobulins plus IV pulse steroid pulse therapy. As I mentioned, pulse therapy, steroid, high dose steroid given over 3 to 5 days, and plasma exchanges. A relapse, you can use combination of the above. Prognosis is improved by early recognition of disease activity and introduction of appropriate therapy. 2-year survival, no therapy, was 2%. When they add cyclophosphamide, was 80%. Remission induced in 90% in Wegener patient with cyclophosphamide. Relapse occurs in 50% in Wegener's, but less than 10% on Pilatus nodosa. Prognosis is good for small vessel vasculitis. This is what I wanted to mention in general about vasculitis. Now I will speak about each type of primary vasculitis according to the size of the vessels. We will take one subject from the large vessel and one subject of the medium and small vessel, and one subject of the small vessel vasculitis.